Well, it's Thursday the 8th of April and you're most welcome to this talk. Let's try and get to the bottom of what's happening with the Oxford AstraZeneca vaccine and these rare blood clots. And these rare blood clots are occurring in combination with low levels of platelets, these small clotting cell fragments in the blood, low levels of platelets. The platelets are called thrombocytes, and a shortage of thrombocytes, or a low level of thrombocytes, is called thrombocytopenia, penia meaning not enough of. So it's these rare blood clots in combination with thrombocytopenia. Now let's start off with the European Medicines Agency before we look at the UK authorities. Now they're saying possibility of very rare cases of blood clots combined with low levels of platelets occurring within 2 weeks of vaccination. Note they're not saying probability, but the evidence is accumulating now. So probability is not a word they chose, but it's one that we could possibly put in there. Now, what I'm saying is that this linking, the probability of this being a causal link does seem to be getting stronger. There is evidence accumulating, but it's still remarkably rare. 86 cases in Europe and 18 deaths. Now, the European Medicines Agency are also saying a plausible explanation for these rare side effects is an immune response to the vaccine. So there is like a possible, what we would call a pathophysiological explanation for this related to immunity. There is a remarkably rare condition called heparin-induced thrombocytopenia, where there's an immune reaction to this drug heparin that's sometimes given to thin the blood, actually. So there is an analogous condition, but it's remarkably rare. I've certainly never come across it, having given heparin out for many, many years. So they're saying this is a plausible explanation. 86 cases, 18 deaths. But they're still saying the benefits of vaccine outweigh the risks. 25 million doses given. Now, I've just done brief calculations. That works out that there's one case per 290,000 doses of vaccine given and one death for 1,388,000 doses of vaccine given. Now, all drugs, all vaccines have risks. And this is a risk, but it's a very small risk. Most cases are women under the age of 60, according to the European information. But Emer Cooke, the executive director of the European Medicines Agency, said there's no available evidence of specific risk factors such as age, gender or previous medical history of clotting disorders. So they're kind of contradicting themselves, really. They are saying more cases in women, but she's saying they can't really relate it to any cause in particular. So, but she does say this vaccine has proven to be highly effective. It prevents severe disease and hospitalisation in COVID-19 and it's saving lives. So how have the European countries reacted? Well, there was a meeting today of the European Union, but they didn't arrive at a particular common action. So individual countries are going their own way. Belgium restricting AstraZeneca to those aged 56 and above. Italy, it's over 60s, not being given to under 60s in other words. No evidence to stop people having a second dose of Oxford AstraZeneca vaccine. Now, this is true, we believe, because in the UK, as we'll see when we look at the UK data, all of the cases of this complication, rare though it is, but all of the cases have occurred after the first dose, none after the second dose of the vaccine. France, only to those aged over 55. Spain only seemed to be giving it between the ages of 60 and 64, so that doesn't quite make sense. But that's what the BBC said. So I'm not quite sure what's going on in Spain. France, only to those aged over 55. Germany, only to those aged over 60s, plus high priority age groups. And the Germans have said that under 60s who've received an AstraZeneca vaccine for the first dose should get a different vaccine for their second dose. This is not what we're saying in the UK, but it's what they're saying in Germany. So again, we're seeing that different regulatory authorities going for different options here of how to implement this information. Norway and Denmark apparently have gone for full suspensions. What's the World Health Organization saying about it? Blood clot link was plausible but not confirmed. Very rare among 200 million people vaccinated with Oxford AstraZeneca globally, is what they are saying. Now, the UK authorities seem to be stressing the risk-benefit analysis. So what they've come up with, this was in, I think it was Professor Van Tam's news conference yesterday, they've come up with this graphic here for the risks. Now, this is weighing up the potential benefits and harms of the Oxford AstraZeneca COVID-19 vaccine for 100,000 people with low exposure risk. Now, at the moment, we are at relatively low exposure risk because this is based on coronavirus incidence of 2 per 10,000, roughly the UK March figures. So what they're saying in the younger age groups, serious harm due to the vaccine could be 1.1 per 100,000. And that's actually more dangerous than the effect of the disease itself, which is 0.8 per 100,000 in people aged 20 to 29 years at the moment. But as you can see, as the age goes up, the risk from the vaccine goes down. So 60 to 69-year-olds, the risk from the vaccine is 0.2 cases per 100,000 people. But of course, the risk of ICU admission here, severe illness, goes up with increasing age. So that's kind of the situation now. And as we'll see, the vaccine is now not recommended for under 30-year-olds in the UK, so it's the risk and benefit of the vaccine. So that's the figure we've chosen in the UK, but we've seen that other European countries have chosen a much higher age threshold not to give the vaccine to people below that age. Now, if there's a higher risk, 100,000 people with medium risk of exposure. Now, this was the case in 6 out of 10,000 cases, roughly the situation in February in the UK. So, of course, the risk from the vaccine stays the same, but the risk of COVID-19 goes up. So we can see the or severe illness from COVID-19. So we can see the rationale for the European countries that have restricted the use of the Oxford AstraZeneca vaccine to the older age groups where the risks are less. And then if there's severe disease around, as they were at the peak of the second wave in the UK, then we can see that there's many more people. The risk of admission to intensive care is much, much higher in all age groups, in fact. So that's sort of the approach that the UK's taken, that risk-benefit analysis. And it does make sense. It does vaguely make sense. Now, the information I've got today all comes, not all, but most of it comes from here. So official government sites. Now, there's a lot of information here, so I'm just going to go through some of the main points. Otherwise, we'll be here for a long time. So this is the MHRA, the Medicines and Healthcare Products Regulatory, what are they called? The agency authority, I can never remember. Can't remember. Anyway, it's the Medicines and Healthcare Regulatory people. So we've seen those slides, the risk of adverse events from the vaccine. So they are, anyway, the MHRA, it's the Medicines and Healthcare Regulatory Agency. Sorry, I've got it right now. Possible risk of extremely rare and unlikely to occur specific types of blood clots. Now, these are particularly the cerebral sinus vein thromboses, but there are some rare types as well. Now, the MRHA have undertaken a thorough review into UK reports, as you'd expect. It's very rare and unlikely to occur. Cerebral sinus venous thrombosis, though, has been reported. But these are occurring together with low levels of platelets. So this is quite an important point. What we're concerned about, initially we thought it was blood clots, but it's not. It is these things occurring together. So it's cerebral venous sinus thrombosis occurring together with thrombocytopenia. It's the combination of these that seems to be this complication of the vaccine. Now, what else are they saying? It also considers other blood clotting cases, thromboembolic events. So it it is also considering other blood clotting cases, thromboembolic events, alongside low platelets events. What they're saying here is that there can be rare blood clots, not just in the cerebral sinus venous system, but in other parts of the body as well. The key thing is the blood clot in combination with the low platelets. They also say that most of these complications occur within the first 14 days. Now, these have been analysed by the Commission on Human Medicines, an independent body, and the COVID-19 Vaccines Benefit Risk Expert Working Group. So there's a couple of groups that have given this recommendations. Now, this is quite important, I think, to grasp, that up to and including the 31st of March in the UK, we've had 20.2 million doses of Oxford AstraZeneca vaccine. Overall risk of these blood clots is approximately 4 people per million. I worked it out at 1 per 255,000. Now, this is interesting because the likelihood of the blood clots occurring from the European data was 1 case in 290,000. That was the European data. The UK data, 1 in 255,000. So we can see that these are really quite comparable figures, indicating this data is probably accurate. Now, the HMRA recorded these 79 cases. Now, 44 of the 79 cases were cerebral venous sinus thrombosis with thrombocytopenia. So 44 are in the cerebral veins, 33 of the 79 cases were thrombus in other major veins with thrombocytopenia. So most of them are occurring in these large veins that drain the brain, but 35 occurred in other parts of the body. Of the 79 cases, there were more women than men, 51 women and 28 men. And they don't break it down by age, but the age range that they took information from was 18 to 79 years. More women have been vaccinated in the UK than men, apparently, anyway. Now, 2 reports of blood clots with thromboembolism reported with thrombocytopenia after 11 million doses from the Pfizer vaccine. So that's an aside on the Pfizer vaccine. So less doses of the Pfizer vaccine has occurred, but there's still been 2 of these rare immunological reactions with thrombus formation with blood clots and low platelets. Could well be more data to come on that, we don't know. Now, getting back to the Oxford AstraZeneca vaccine, there's been 19 deaths, tragically. So of that group, of that 79, there was 19 deaths. Now, I did work out the deaths. So that was the deaths I worked out in the UK. That was the deaths from the European data. 1.38 million from the European data. 1 in just over a million from the UK data. So again, there is consistency. Now, 19 people have died out of the 79 cases, tragically. 13 women and 13 females, 6 males. And they are women and men. Boys and girls haven't been included. They're not being vaccinated at the moment. 11 out of the 19 people who died were under 50, 3 of whom were under 30. 14 of these 19 cases were cerebral sinus venous with thrombocytopenia. So they were the causes of deaths in 14 out of 19. 5 of the 19 were thrombosis with thrombocytopenia in other parts of the body. But all 79 cases occurred after the first dose of the vaccine. So these were all after the first dose of the vaccine. Now, we need to keep this in context. As of April the 8th, last 24 hours, another 53 people died of COVID-19. Still, 126,980 deaths, or 149,968 deaths, if you take the death certificate data. So when we remember the amount of people that have died of COVID-19, this does put this into some sort of context. Now, the level of risk, the level of risk has gone up slightly now that there's more information available. These are numbers from the 31st of March, slightly higher than the 24th of March. So the data is evolving, unfortunately, in the wrong direction at the moment. Now, guidelines. Now, this is the HMRA here, and they are saying this. HMRA not recommending age restrictions for COVID-19 vaccine and AstraZeneca use. That's what they're saying. But the Joint Committee on Vaccination and Immunisation are saying, acting on a precautionary basis, these persons, that's people under the age of 30, still unvaccinated, it's preferable for them to be offered an alternative COVID vaccine if available. And in the UK, that would be the Pfizer or the Moderna, not the Oxford AstraZeneca vaccine. So that is that one saying not age restriction. That is that one, the JCVI statement saying there should be an age restriction. So we are going with the Joint Committee on Vaccination and Immunisation and not giving it to the under 30s in the UK. That's what the current guidelines are saying. I'm just going to read some of these guidelines out. We haven't got time to do them all indeed. They are all on those reports. I've just got them straight from the reports. These are not from popular news outlets. They're direct from these websites. HMRA is not recommending age restrictions, but as we say, the vaccination people are, so that's what we're following. People any age who are at high risk of blood clots should only be given the vaccine if the protection outweighs the potential risk. So what they're saying to doctors administering vaccines and teams administering vaccines, that people of any age who are at high risk of the blood clots should only be given the vaccine if it's overall safer for them as an individual to be given the vaccine. And in most cases, that will mean they probably won't be, I would imagine. Cerebral or other major blood clots with low levels of platelets after the first dose should not have a second dose. In other words, if people have had major blood clots or the platelets have dropped after the first dose of the Oxford AstraZeneca vaccine, they should not be given the second dose. But anyone who didn't have the side effects should be given the second dose. And remember, all of the 79 complications occurred after the first dose. Pregnancy pregnancy disposes to thrombosis, discuss with their healthcare professionals. So if any possibility that someone could be pregnant, flag that up to the team before vaccination. Now, the guidelines don't mention oral contraception. I think oral contraception is worth flagging up to the vaccination team if you're on oral contraception. They don't say that, but the cerebral sinus venous thrombosis normally, although it's very rare, I understand it to be more common in people that are on oral contraception. So it's worth discussing that with the team, and then the decision can be made. Evidence to date does not suggest that AstraZeneca vaccine causes venous thromboembolism without a low platelet count. Now, we talked about this when we talked about deep venous thrombosis and pulmonary embolism, because that's initially what it looked like they were talking about. But here they're saying that the vaccine is not causing that. This is this specific type of blood clots of thrombosis, but accompanied by low levels of platelets. It's the low levels of platelets. Now, they do give some precautions for people to look out for after they've been vaccinated. So people with shortness of breath, persistent abdominal pain or leg swelling should report for medical attention. Blurred vision, confusion or seizures. So basically this shortness of breath, chest or persistent abdominal pain, they're related to blood clots. So the shortness of breath could be pulmonary embolism, for example. Blurred vision, confusion or seizures are brain-related things related to the blood clots in the veins draining the brain. Pinprick rash or bruising beyond the injection site, that could be a sign of blood leaking into the tissues, which could be a sign of the low levels of platelets. So that should be reported. New onset of severe or persistent headache that does not respond to simple painkillers, starting 4 days or more after vaccination, those people should speak to their doctor. So in other words, headaches in the first few days after the vaccine is not too uncommon, but they're saying if it starts 4 days after the vaccine, doesn't respond to painkillers, should speak to their doctor. I think that's what that's saying. New onset of severe or persistent headache that does not respond to simple painkillers. Starting 4 days or more after vaccine, should speak to their doctor. And of course, speak to your doctor if you're worried. Now, Dr. June Rain, Chief Executive Officer of the MHRA, over 37 million doses of vaccine against COVID-19 have been administered in the UK, saving thousands of lives. Let's not forget that. No effective medicine or vaccine is without risk. Absolutely not. You know, people are always saying to me, is this treatment safe? Well, no treatment is safe. There's always an element of risk. All medical treatments have an element of risk. As I've said before, the only safe treatments are homeopathic treatments because no doses of the active molecule is given. Therefore, they're safe. Any other time, there is an element of risk. There's an element of risk taking aspirin. But aspirin, quite a few risk taking aspirin, actually. Ibuprofen, that there's risks with all of these things, but also potential massive benefits. Again, direct quote, we continue to monitor safety during widespread use of any vaccine. These blood clots remain extremely rare and unlikely to occur. Okay, she then encourages the use of the yellow card system, which is click on that website, anyone can report there. It is still vitally important that people come forward to their vaccines for their vaccines when invited to do so. So there we have it. That's basically what's happening. The thing that's really convinced me that there is a genuine... my current belief, evidence can change, is that there was a causal link between the Oxford AstraZeneca vaccine and these extremely rare events. They are extremely rare. Remember the European data, 25 million vaccines given, 86 cases. So very rare events, and all medicines, all vaccines have an element of risk. And as we've seen, it's always this balance of risks. Now, the risk here is that people will not want the Oxford AstraZeneca vaccine and would prefer to go for an alternative vaccine. That's understandable. But of course, as more data comes out from these alternative vaccines, then it may turn out that there's complications from them as well. So more to come on that story, but that's where we are now. And European countries restricting the use of the Oxford AstraZeneca vaccine in younger groups does seem to be a reasonable precaution. Now, I think I will say one more thing. This is advice for healthcare professionals from the website. Following administration of the S-glycoprotein of SARS coronavirus 2, is expressed locally, stimulating neutralizing antibodies and cellular immune response. So in other words, when you give this vaccine, you're giving you're giving it in these adenovirus vectors that contain this in the case of the adenovirus, the DNA to code for the spike protein, and that goes into the cells in the arm where you give the injection. And then that causes the cells in the arm to start producing these spike proteins that are the same shape as the spike proteins on the SARS coronavirus 2, that are then recognised by the immune cells to generate the immune response. That's the way it's working. So following administration of the S-glycoprotein of SARS coronavirus 2, it is expressed locally, stimulating neutralising antibodies and cellular immune response. So this, in this case, would be a muscle cell in the deltoid muscle where that's been given. So you would give the vaccine into the deltoid muscle. The adenovirus vector carrying the information to make the spike protein goes into that cell. It's made by that cell. It's expressed by that cell locally. And it'll also be picked up by what's called antigen presenting cells and go into the lymph nodes as well. So that's what's supposed to happen. Now, in Denmark, they've thought that there's a risk that when you give an intramuscular injection, that you can give it into a blood vessel by mistake. Now, this possibility is not mentioned. You see, these are all these things that we've been discussing are all blood problems, the thrombocytopenia and the clotting. They're affecting the blood. So I'm just wondering, this is a question for the regulatory authorities. This is my question. If the vaccine was inadvertently given into a blood vessel, that would mean that the vaccine went into the blood vessel. Would that mean that the vaccine then went into blood cells, and instead of the muscle cells in the arm expressing the spike protein generating the immune response, blood cells started expressing the spike protein? Now, if that's the case, could that expression of the spike protein and the immunological response that would generate in the blood cause this rare complication? Now, in Denmark, they think that's a possibility. So they've told people to make sure they give the vaccine into a muscle. Now, I've been given intramuscular injections since I was 18. And don't worry, this is not the vaccine's not as big as this. But what you do is you stick this into the muscle. And we were always trained to draw back to see if you get blood. And if you don't get blood, then you inject, because you know you're in a muscle. You're not giving it into a vein. And in fact, I used to give what we call depot-phenothiazine. See that bubble there? It's just habit to knock those out. So, not that I'm injecting anyone with this. So what I used to do, giving these thick, oily things, and of course you don't want to give those into a blood vessel. That would be very serious. So you would stick it in, and we used to use the gluteal muscle at the top of the buttock, upper right quadrant of the buttock. You used to stick it in, aspirate, inject some of the medication. Then halfway through, I'd actually aspirate again just to make sure the needle hadn't slipped, and then give the rest. So that's important, but the World Health Organization guidelines don't mention aspirating. The Green Book Infection Against Disease guidelines in the UK actually say you don't need to aspirate. So I would like to ask the regulatory authorities, why don't you need to aspirate? Because it could be given into a vessel inadvertently. Then would that make blood cells generate the spike protein and have an immunological response as opposed to the muscle cells? And could this be responsible for these side effects? Well, the Danish authorities think that's a possibility and have changed the guidelines accordingly. So that's my question to the regulatory authorities. Why aren't we ensuring we give it intramuscularly by aspirating? And I can just show you what you see when you aspirate. I have shown you this before, but it doesn't do any harm to look again. If I can get the right one, there we go. Yeah. So imagine that's a blood vessel there, and instead of giving it into the muscle, you give it into a blood vessel. Then what you see when you draw back is very obvious. You can see blood coming into your syringe, and you know it's in a blood vessel, so you don't inject it. So that would be my question to the regulatory authorities. Wouldn't it be safer to consider a Danish approach to this and change the guidelines to advise vaccinators to aspirate prior to injection? Just a simple question. If HMRA or the vaccine people want to get back to me, I would love to hear from them. Okay, so bit long and complicated. There is a link. It's still very rare, and the government is still saying come forward for vaccination when you are called. Personally, well, my first vaccine, as it happened, was Pfizer, but personally, for my sex and age, I wouldn't hesitate to have the Oxford AstraZeneca vaccine. But we must go by our regulatory authorities, and they are varying slightly depending where you live in the UK or whether you live in the European Union area. So I hope that makes sense. I know it's a bit of a quick whiz, but that's roughly where we are. And as I say, look on all these websites. So all that information I got, apart from the European ones I got from the BBC, but all this is from so that's the JVCI. That's on that one there. You can download the full document. That's the HMRA one. And again, everything there with additional links. And that was the PowerPoint we looked at for the relative risk. So everything available for you to check out for yourself. But for now, thank you for watching.